I'd like to welcome you all again, and I'd like to say that it's such a great pleasure for me to moderate yet another exciting event by Cairo Climate Talks. So to tell you briefly about myself, I'm an environmental researcher and I have a background in marine ecology. I've been working in the field of conservation and environmental consultancy as well as teaching in Egypt. And now I'm currently enrolled as a PhD candidate at Wageningen University in the Netherlands. And I'm actually researching a topic that is quite related to today's topic, addressing actually how anthropogenic pollutants in the Red Sea are taking a toll on reef fish community and how they can further induce rapid evolution in reef fish. So I would like also to introduce Cairo Climate Talks for those participants who are their first time. So Cairo Climate Talks have been serving as a platform to exchange experiences, raise awareness, and foster cooperation between policymakers, business, the scientific community, and civil society. Thus far, Cairo Climate Talks has addressed various topics in over than 60 sessions that all feed into the impacts of climate change and environmental challenges. Session topics have ranged from clean technology and food security to public health and energy. So today's topic, water pollution and medical waste, and dealing with the COVID-19 waste in particular, aims to engage us all in a dialogue to address the threats imposed by the surge in solid waste, especially associated with the pandemic, and how it affects human health, livelihoods, and the environment. Since people's movements and industrial activities were closed down for weeks during the pandemic, it was expected that pollution loads to the environment also get decreased. And as expected, in a matter of days in some countries like China, for instance, between early February and mid-March, the carbon emissions level has dropped significantly, about an estimate 18%. Scripps Institute of Oceanography reported that the use of fossil fuel would decline by about 10% around the world owing to COVID-19 spread. Also, many people on social media have started sharing photos of animals roaming the streets and waters clearing up from pollutants, despite the rumors that some of them are fake. But actually, there is growing scientific evidence that there are some good impacts, especially on water quality due to the lockdown. So while these improvements in environmental conditions are considered to be temporary, now there is a growing health and environmental concern accompanied with the surge in waste generated due to COVID-19 in particular. And already, according to the World Bank, we generate over 2 billion metric tons of solid municipal waste. And in low-income countries, the volume of waste is expected to triple by 2050. While there are not much data available on the amount of solid waste that is solely attributed to waste associated with COVID-19, the municipal waste management needs to be addressed, considering many factors such as the vulnerability of workers to disease, differences in waste management system, and the environmental conditions in each of the affected regions. Based on existing knowledge and research, there is also no indication that COVID-19 can persist in drinking waters and also for wastewater. Some recent studies have found some RNA fragments, but they're not really infectious in wastewater. However, the waste associated with COVID-19 should not only be a concern to us from an infection perspective. COVID-19 has increased our reliance on plastics for safety and hygienic purposes, which in turn imposes threats on the biodiversity, both in the terrestrial and aquatic ecosystems. And of course, it adds up to the woes of our management system. So today, Cairo Climate Talks gathers reputable panelists addressing waste issues from different perspectives. And we highly anticipate the input and reflections of our esteemed guests and participants. And so our agenda starts today with welcome remarks, followed by a panel discussion. then a Q&A session. So I'd like to remind you again that you can submit your questions in the Q&A button below. And I'll pause once more for the newcomers, new participants to say a statement in Arabic to let them know that there is an interpretation button. أنا بس حابة أفكركم تاني إنه في زرار تحت مرسوم عليه علامة الجلوب أو هتلاقوه تحت نقدر من عليه نوصل للترجمة. الترجمة ما فيش اوبشن مكتوب عربي، الترجمة مكتوب عليها جيرمان بس جواها الترجمة بالعربي. Sorry for that. I'll get back to English, and I'd also like to mention that there is a translation button down there. You can access English and Arabic translation, but the Arabic translation is through the German channel. So now I would like to introduce Mr. Uwe Gehlen, the head of cooperation at the German embassy, for his welcome address.
Thank you very much, Nada. That was very kind. And actually, I must accuse myself that I'm not speaking Arabic, honestly spoken, because this is the Cairo Climate Talks and not the Berlin Climate Talks, which would probably not so different from this one, addressing issues related to the agenda of today. So I would like to say a warmly welcome on behalf of the German embassy and the German government to everybody who's attending, and understanding this is a very timely and very good discussion. I don't want to make substantial technical remarks or even getting a little broad, because this would be addressed by my dear colleague Ruth Erlbeck from GIZ, which is very strongly engaged in this discussion and in this agenda. German Development Corporation, the German government, is strongly supporting the Egyptian government in getting a way forward, let's say getting out of this this stucking problem of addressing waste and solid waste issues and liquid waste issues. But I can't start and only say welcome without doing a substantial remark I have in my mind. I learned in my slightly long career now, I'm probably one of the most mature people here on the floor, that a lot of things can be achieved, can happen when they are just pushed by internal or external shocks. I think this is something what we have to have in mind when we address issues like this one. The world is not going forward in the same way like it did just half a year ago. And this is a very strong obstacle for a lot of people, but it could be also extremely positive moving into a discussion which is very necessary. Just only one anecdotally observation. When I was a child in Germany, you know, you see this today, everybody, if he's traveling to Germany and he's coming back, when you ask him, the first impression he has is, it's so clean. This is something what is really standing for Germany, to be clean. I don't know if this is the way I would like to be seen in the first priority, but it's a fact. When I grown up, when I was a child in the 70s, honestly spoken, I'm grown up in the Cologne area. We had a strong air issue. So I wasn't able to attend school at certain days a year because we had so many smog. The Rhine River, this proud river where I was born and raised beside of this, and which is deep in my soul, like the Nile River for an Egyptian, was so dirty that there were no fishes alive at this time. And when we had some waste over in my household, my father took me in his car and we drove to a landfill site between Bonn and Cologne, where, you know, the birds were hugging on the waste. And it was so smelly, it was so unbelievable dirty. I hated it so much. Today, this landfill is covered. There are no landfills in Germany anymore. Today, you can swim in the Rhine River. And there is no school off because of smog, because the air is so clean. And the reason why it's so, it's not because we're so sufficient and technically approached. That's, you know, this, you can learn this, you can buy this. The thing is, we had a valid public debate on this in the 80s, because there was a strong Germany, the growth and industrial growth just created an environment where people weren't able to anymore. And I'm very much looking forward that we have such a strong discussion in Egypt. And I already see that coming up. And I see myself being in a household challenged by not be able to apply things I learned in my household in Germany, which would be so easy. Last, actually, what's not had to be forgotten on that is it's not only a technical issue. It's not only the issue of waste. It's not only the issue of environment. It's a strong social issue. The question how you addressing people who are taking up this issue and what status you give them in society. This is something which is very important of succeeding. And when I see this tremendous amount of waste workers in this country who do a very unbelievable work every day, they should be treated in a proper way.
Maybe we can start by introducing our panelists for this evening. And I would like to first introduce Ms. Ruth Erlbeck. Ms. Ruth is a solid waste management expert, and she's currently the project manager of the National Waste Management Program in Egypt at the GIZ. The project was initially launched in 2012, which aims at restructuring the waste sector at the national, regional, and local level, and establishing an independent central entity to regulate the management of the municipal solid waste system and establishing waste management units in 4 governorates. Previously, Ms. Ruth held the position of project director at the GIZ on integrated resource management in Asian cities, tackling topics of secure water supply and sanitation systems, energy security and efficiency, land use and food security. Welcome aboard, Ms. Ruth.
Thank you very much.
And also I'd like to introduce Ms. Syada Greiss. She's a development consultant and experience in the domain of project management. In addition to contributions in the field of social research and development, Ms. Syada is currently the board chairperson of the Association for the Protection of the Environment, an NGO that was established to address the needs and rights of garbage collectors communities in Cairo. During the course of her professional career, she headed the Socioeconomic Development Department at Environmental Quality International Consulting Firm and was the director of the Canadian International Agency's Program Support Unit. And welcome aboard, Ms. Syada.
Thank you.
Also, I'd like to introduce Mr. Salem Massalha. He's a social and environmental entrepreneur who has a long-standing experience in the field of development. Mr. Salem is the co-founder of Bassita community, specializing in social media campaigning and marketing solutions. He developed an award-winning innovation called Click Funding that enables causes to raise funds and awareness through social media interactions. Mr. Salem is also the co-founder of the VeryNile project, which is the first initiative to develop large-scale means to clean the Nile while raising awareness on the importance to protect our environment. Welcome aboard, Salem.
Thank you very much. I would just like to add one line, and this is for Mrs. Greiss. I used to be back then a volunteer at the Association for the Protection of the Environment, and I had beautiful years there.
Great.
Well, I'm very happy to be part of this.
All right. I'd also like to welcome Mr. Ayman Sabae. He's focused on quality management processes for healthcare, social innovation, organizational development, and project management. Mr. Sabae is the CEO and specialist in international health system management at Shamseya for innovative community healthcare solutions. Among his other focus areas are the legal framework of public health law, which led him to partake in the creation of the Egyptian Charter for Patients' Rights. Welcome aboard, Mr. Ayman.
Thank you.
I'd also like to welcome Mr. Essam aboard from the Ministry of Environmental Affairs, handling medical waste management unit. Welcome aboard, Mr. Essam. All right, maybe I can start the discussion by actually talking about how the pandemic has already had tremendous impacts on the waste sector, and many countries nowadays and also public authorities and municipal waste operators had to rapidly adapt their waste management systems and procedures to the situation. So my question to Ms. Ruth, based on your expertise in solid waste management, how do you think we can adapt the current waste management plans in Egypt to accommodate for the post-pandemic surge in general household waste?
Yeah, well, I think there's a short-term strategy. First of all, thank you very much for your introduction, your questions. Yeah, well, I think first of all, there's a short-term strategy and there's a long-term strategy. I mean, regarding the long-term strategy, I think we are all very happy that only recently, that means on August 19, the waste law, which was sort of processed for quite some time, more than 2 years, has finally been approved by Parliament. That, I think, gives Egypt a much more solid basis to continue with the reform regarding solid waste management. Regarding this reform, of course, now some immediate action is needed regarding the issues of Corona, the Corona pandemic, which sort of came over us and all caught us by extreme surprise. Nobody was prepared for that, nobody all over the world. I must say that I think Egypt reacted very, very quickly after we saw what is going to happen with this pandemic, and at least I can only talk for the waste sector, of course, and we were immediately requested by our Egyptian partners, this is the Ministry of Environment, to support them in first of all in the procurement of safety equipment for the PPE, proper personal protective equipment for the waste workers all over the country. And if I say we, I say the German side, that means financial cooperation and technical cooperation, because we together, the KfW and GIZ, are cooperating with the Ministry of Environment in a quite comprehensive solid program by the EU. So this request came to us that we should sort of help them in the procurement of that material for the waste workers. And as Uwe mentioned, these are actually the poor guys who are really daily exposed to waste, and that also of course means they're daily exposed to precarious working conditions, but of course also strongly exposed to the Corona pandemic much more than all of us are. And so we started this together with our partners. We started an intensive procurement process, trying to procure goggles, overalls, special boots, gloves, masks, medical masks, etc. For the waste workers. We did concentrate on the 4 governorates we are working on. I think you mentioned them, Nada. We are working in these 4 governorates, Asyut and Kina in Upper Egypt, and Kafr Sheikh and Gabeya in the Nile Delta. So the procurement of all this safety equipment was or is being done by the ministry, but together with the KfW, our sister organization, and we sort of immediately started off together with the ministry in developing videos which sort of help to videos especially directed to first of all to the waste workers, but also to hotel management, to the solid waste management stuff in the different governorates, to sort of inform them and sort of do capacity building in how to deal with this new situation, how to deal with the waste, and also of course for the citizens, and separation there of waste, of course, it is always a topic as such, but now even more so, because we should really separate, of course, all what is connected with which could be connected with the COVID, separate that from the normal waste. Moreover, we conducted a lot of webinars with local experts, again with the target groups I just mentioned, to make them aware of the situation and tell them how to protect themselves, how to protect us in this way. So yeah, that's what has been done now. Of course, your question also went further and said, okay, what do we now do with this larger amounts of basically plastic, but hazardous, partially hazardous coming in? Again, I think, of course, there first of all, we have to try and go for even more segregation of waste. But we have to continue with a structural reform of the waste sector, going for more separation, taking care of hazardous waste in particular, structuring the whole system. And yeah, so that's what we are going to do. Maybe I should leave it there for the moment. Yes, thank you.
Thank you
I
very
hope
much.
I more or less answered your question.
Yes, that takes me actually to the point of like the vulnerability of waste collectors. And actually, I wanted to ask this question to Ms. Syada and further elaborate about. Of course, the waste collectors are now considered frontliners for coronavirus, and can ask more Ms. Syada about the key challenges they face, and in terms of the more vulnerability to infection, and how they're adapted post-pandemic, and what percentage of them have been infected already, if this is
the people that, I mean, the community that we are dealing with is an informal community. So this is not part of the formal waste collection system. So that puts them in another category. This group is very vulnerable because they have not been recognized as such as making a vital contribution in the waste management sector to the city of Cairo. However, a misfortune or the floods, the flash floods that took place in the 15th of, I think this was the month of March, yes, just before Corona, alerted the government to the fact that this was a sector that needs to be recognized and given full rights and integrated within the whole framework of the waste solid system. So for the first time in the history of garbage, this group's efforts to and contributions to collect garbage in the city of Cairo that began in the 40s, and now we're 2020, the government finally is going to create proper housing for them and give them the right to be able to raise pigs, because this was also a very sensitive question. So at least we know that there is recognition for this group of people, but this is just one group. In Muqattam or Manshiat Nasser, where we are based as an NGO, I cannot tell you for sure what is the percentage of cases in the community that were infected with COVID-19, but my from the reports that we receive verbally from a hospital in the community, I do not think that the percentages were much higher than anyone in the city. We don't have the reports that we get are those who are hospitalized, I imagine, but not those who are tested positive for corona. However, that said, in the community, we immediately took steps as an NGO to raise awareness among the garbage collectors of the need for them to protect themselves, offering them, insisting that they should wear masks, that they should protect themselves and their children. And then, of course, the lockdown had to be enforced. So we, as an NGO, enforced this lockdown. However, what we did in return is to provide some monetary support to so many who lost their jobs, who were very vulnerable, because these people are not regularly employed. They don't have insurance coverage. They don't have many of the rights that many other Egyptians have. So it was for a period of 3 months, our NGO was supporting 1,000 families in the community by offering them monetary assistance, and then providing support financially for them, for those who were suspected of having corona, to get the PCR in a hospital in the community. But again, there are the positives that were mentioned before. I think COVID-19, as far as the waste management sector and climate in particular, has had a positive effect. We have to recognize that we are living in a much healthier climate, that we don't have the pollution that existed in the city as much, and we should actually take these lessons learned from our experience now, because the post-COVID era is going to be very different from pre-COVID. We all recognize that. So how do we prepare for the post-COVID and make the best use of it by looking at measures that have to be taken so that we, first of all, in the garbage collectors community, do much more efforts to integrate those who are still in the business, to integrate them in the formal sector. So if the government really has a strategy, it must be inclusive of those who have been marginalized from any of the strategies for the past 40 or 50 years. None of the waste strategies have included this group of people who have actually alive and doing the job, and nobody recognizes them. And then they are not doing it for much money. They get very little returns. What they make is out of sorting the garbage that they collect. And this is what makes them vulnerable, of course, in a Corona era. However, they were always vulnerable because they used to collect also hospital waste, and hospital waste is very hazardous. However, there have been many measures to eliminate, to put strict laws and reinforce and penalties for those who still bring hospital waste, because this is by law is not allowed. So I think civil society has to play a very important role in this respect, raising awareness within the community, providing necessary services so that people can become citizens in our country who are recognized, whose children are offered an education, who are offered health services. And the empowerment aspect for women is very, very important. And this is one of our objectives as an association. We are very inclusive, and we believe that women they play a vital role, and it's empowering them. They will be able to transmit that to their children. I feel very strongly, about some of those issues, and I still feel that there is a lot that has to be done to be able to manage the waste collection system in the city of Cairo. I can speak about Cairo. I think maybe, hopefully, something will happen, but always remembering that Cairo was much better before the culling of the pigs in 2009. And we always forget the damage that we do has not been rectified till now. Till now, we don't have proper treatment for or places for those who are raising animals and whose livelihoods depends on that to have space for it. So it's a very, till now, has not been properly addressed. And people survive, people have survival mechanisms, and they will do what is necessary to be able to make a good livelihood out of the means that they have. And garbage happens to be a major wealth and a resource for people, for anyone who is in this business.
Of course.
So let's improve conditions for them so that they can continue to do what they are doing, but do it in a safe way.
Yes.
Talking about. I didn't talk too long.
Yeah, no, not at all. You're giving us great insights. And actually talking about improving conditions, I have a question actually addressed to Ayman. Since Ayman, you're working a lot with facilitating the means through which marginalized people can access healthcare, insured people actually as well. And you mentioned your initiative at Shamseya, you mentioned that a lot of people who are already insured do not know how to access the healthcare system. So imagine a marginalized group that is not insured. How do you think, based on your experience, we can empower waste collectors to access healthcare systems in such times? given that they're already marginalized, as we know, and as Ms. Syada elaborated, and if there is a grievance mechanism in place to support them.
Yes, I totally agree with what you mentioned. I can elaborate further on that. But let me actually tell you how the way the healthcare system is managed in Egypt and how it is designed in a way that doesn't necessarily fit the needs of marginalized communities in that case. And I would actually share with you maybe some things that would illustrate that further. So first of all, we need to realize that the way the healthcare system functions in Egypt, for some reason I can't share the screen, so if you can attend to that, that would be great. So yeah, so in Egypt, it is estimated that 58% of people are actually insured by the National Insurance Scheme, which is a relatively high number. But when we look at the figures with an even closer attention, we realize that the situation is actually a bit different, because from those 58 people who are actually insured, according to the latest demographic health survey, the poorest quintile, the poorest people in the country, are actually the least with the access to the insurance schemes. So we're estimating, according to the latest DHS that was published in 2014, only 14% of those who are insured from the poorest quintiles of the population actually end up using their insurances. So here we're talking about people who are actually eligible to insurance, but they actually don't manage to use it in a way. So this is the first point. The second point is that even within this group, you will see that there is a significant discrepancies that includes gender, that includes education, of course. And gender in specific is really important. So when we look at women, it is estimated that only 8% of insured women actually end up being able to use their insurances. The main reasons behind this is mainly because they don't know that they are entitled to an insurance, or in many cases, they don't know how to actually go through the bureaucracy, go through the steps, end up using the services that they are entitled to. Now, in the current context, it is, I'll actually show you this. Thank you, Amina, for taking care of that. Yeah, I think you can see my screen now, no?
Yes.
Perfect. So yeah, and if we look at yeah, okay, now it should be okay. Yes, perfect. So yeah, and women are especially vulnerable in that case. Now, recently, Egypt has announced that it is beginning its universal health insurance coverage. And a core thing that we have been advocating for during the work on this law is to be able to cover the informal sector. The way this new law will tackle this group is that it has in it implications that actually the government is going to pay the premiums for all those whose income is below the minimum wage. Of course, this is assuming that proper documentation and valuation of people's income can be put into action, which is not necessarily easy. But till then, mentioning the efforts and what can be done to address these things, we have created actually a tool to help people to navigate through the insurance schemes. And it is as basic as a phone number. So it's a phone number that we're making available to people who have problems accessing the service that they're entitled to. And our goal is to be able to direct them to be able to access the service they're entitled to, be it through the insurance scheme, the payment on the expenses of the state, even in some cases, NGOs. We believe that every single person is covered somehow, and it's our role to make sure that they are actually managed to get to the package or the insurance scheme that they use, especially that in most cases, the reason why they can't access these services is a matter of awareness and knowledge. Just a couple of days ago, we had a case of a day worker who's also working in the waste disposal sector. And he's been going around asking people for donations to support him in a surgery that is needed for his son. So he's asking for a total of around 8,000 pounds, which was for me a bit suspicious because why do you need to sound this and take loans from people in order to do something that you should be able to get? Because first of all, his son is insured because he's a school student, and according to the Egyptian law, all school students are insured. Second, even if he's not insured, through the payment on the expense of the state, this should be covered. And we realized that it was just a matter of being able to navigate this person in order to access a much better quality service without having to pay almost anything. And in that case, even NGOs who are doing the incredible work of supporting such people can actually provide them with the support that is additional, not the core, not the parallel system that needs to be created in order to cover these vulnerable populations. So this is in brief what I wanted to mention, and an example of what can be done to actually address specific vulnerable populations in this case.
Thank you very much, Ayman. That was very enlightening, and I'm sure there are a lot of cooperations that could come out of this. Once such marginalized group have accessibility to services that you provide, for instance. And my other question actually was regarding to another comment that Ms. Syada mentioned, the hazardous waste, the medical waste that gets disposed, and making this group vulnerable, and actually making other groups vulnerable as well to such hazardous waste. So my question is for Mr. Essam. Could you tell us about existing medical waste disposal means that we have in place, and how also they are adapted in such current pressure due to increased medical waste?
People were staying at home for a long time. That's why we were giving them advices to be careful with regard to the immunity, sport exercises, staying at home for a long time changed the consumption. That's why the waste amount changed as well, and the state was quite aware of that. That's why they knew that waste may cause a problem, and it may be a reason for the infection in case that there are cases that are not getting the healthcare services. We had another problem during COVID-19. We had isolated areas, maybe villages or whole cities were separated, and sometimes we have streets, we have in other areas houses that were separated or isolated as a matter of quarantine, and we, the Ministry of Environment, in cooperation with Ministry of Local Development and the governorate, we intensified the work hours.
We were actually this has actually an impact in addition to the awareness programs, and we have actually managed to prevent a strong source of the infection, that is the municipal wastes, particularly because most oftenly it was mixed or intermingled with the medical wastes from the coming out from the households or the segregation areas, and that could not be embedded there in the segregation or in the quarantine hospitals. So this has actually impacted the waste system, and we hope that there will be no more waves of the pandemic, and we hope to deal with the companies or it is quite worth noting that we have implemented a number of awareness programs We have implemented through the GIZ programs. We have implemented a number of awareness programs through the housewives and those who are working in the cleanness or the cleanliness and the tourism sector, all the sectors that have been dealing with large numbers of in the communities, in addition to the youth. So there were a number of training programs in order to guide them how to deal with the wastes within the framework of the hard times of the pandemic. Thank you. أشكرك شكرا جزيلا وأنني and I'm quite apt and ready to respond to all your questions. سوف الآن
and now I'd actually like to shift gears a little bit in our discussion to talk about the environmental impact. So adhering to the environmentally sound practices during a time of a pandemic for waste management is quite challenging. And but we still have to maintain high environmental standards, and enforcing it is not the easiest job. So my question is actually to Salem. We have a lot of personal protective equipment and other hygienic materials used in hospitals and households. How do we avoid the use? These materials are mostly made of plastic, and a lot of restaurants and supermarkets are resorting to the use of single-use plastic, and more. We see a lot of packaging, and we already have tons of that. How do we avoid the use of single-use plastic while staying safe is a priority? And how likely is it that businesses respond to remaining sustainable while staying in business, because also it's a rough time for them?
Thank you very much, Nada. It's really a pleasure to be here. And I just want to clarify that my point of view is not the point of view, or what I'm going to say is not the point of view of a researcher, but it's the one of a social and environmental entrepreneur. I completely agree about the increase of single-use plastic, and I'm very much surprised. I'm very much surprised. You just cited, for example, the example of restaurants. And when you go in Cairo, in some restaurants, you have some people that's going to put the forks and knives in plastic, and this will give the impression to the customer that the fork and knife is corona-free. But it's completely not the case. It's just a psychological support, because if the plastic is contaminated, the people will get contaminated.
Exactly.
In some places, if you go to Egypt, they will give you some plastic box within plastic, within plastic, within plastic. Or in some restaurants, they will add extra layers of plastic. Some deliveries, they said it's corona-free because you have 4 layers of plastic. But it doesn't depend on the numbers of layers of plastic, because as we all know, the corona can be contaminating surfaces, and the last surface of plastic can be the one contaminated. So actually, it's kind of dangerous. It's first of all dangerous for the environment, because we are really increasing the use of single-use plastic, not only in Egypt, but throughout the world. And you have some studies to see that the plastic lobby is doing a lot of campaigns in order to have back the single-use plastic bags, in order to hit back the market, because recently they've been a bit out of market because of the increase of environmental awareness. And you have a lot of lobbying that has been done in the US, for example, on this issue. But at the same time, we see plastic as something that is clean, when in case it cannot be clean at all. And we see plastic as something that's going to protect us from the corona. But if you go and look at the health regulation, if you go into a restaurant, for example, the best way to be protected by the waiter is simply for the waiter to clean his hands on a continuous basis between each customer, to clean the table, to clean the glasses, you know what I mean? Because if the waiter is going to bring you the forks and the knife into a plastic bag, and he has corona and he just put his hands on his face and then he's giving it to you, it's the worst thing ever. And sometimes the plastic can have also very negative effects, because people will think it's clean, but in fact it's contaminated. So now when you eliminated all of these extra single-use plastic that are fake psychological layers, because it's completely psychological, exactly, people will start more be aware about the importance of cleaning their hands, the importance of wearing the mask, the importance of not putting your hands on the mask, and so on. So I think that it's very, very important to acknowledge that this use of plastic is very much psychological. Same thing goes with shops. Before the corona crisis, we launched with Her Excellency, the Minister of Environment, Dr. Yasmin Fouad, and Zamalek Association, a campaign to buy
Salem, sorry to disrupt you. Could you please slow down because some people are having trouble to cope. Yeah.
Absolutely.
Keep up. Yeah.
Yes. So just what I was saying before is that the use of plastic may be more psychological than health-wise because plastic can be contaminated. An example that we had as a social entrepreneur is that before the Corona crisis, we launched a campaign with the Ministry of Environment and the Zamalek Association to make of Zamalek the first neighborhood in Cairo free of single-use plastic bags. And the idea was to prototype a neighborhood where civil society would get rid of single-use plastic bags from themselves, bring alternative, and after to scale it up to the rest of Cairo. So at the beginning, when we started speaking with shops and outreaching shops, many shops joined the initiative. Many shops were extremely happy. Many people had a proactive stance. Many people understood that the customers, this is what they wanted. When the Corona outbreak started, many shops reverted back to the use of plastic. Why? We have no idea. Paper bag is not more Corona, you know what I mean? It's a plastic bag. But I think some people took this as an economic advantage as well as to go back to plastic. So what I'm just trying to say is that single-use plastic in certain cases can be extremely useful. If you go to the doctor, for example, he needs to put a combination of the single-use plastic, the guanti, the mask, and so on. It needs to be single-use in certain medical instance. But most of us as people, as consumers, as people living on the daily basis, a lot of the single-use plastic that we are using is completely psychological and can have a bad effect because instead I see some people in the street wearing the same guanti the whole day, or I see some waiters in the restaurant serving with some guanti. If they think that the guanti is going to protect, it's not true because it can be full of Corona. The only real way of protection will be, sorry, when I say guanti, I meant gloves. The only real way of protection it is to clean your hands, wear a mask, and do social distancing. And it's not the plastic that's going to save you.
Thank you very much, Salem. Actually, still talking about the environmental impacts, there are some countries nowadays that have strategic movements to accommodate for the surge in waste by including the use of industrial furnaces and cement kilns to co-process hazardous waste. And I'd like to ask Ms. Ruth, as a waste expert, what do you think of this strategy from an environmental perspective? We already have the problem of the surge in plastic use, and now some strategic movements using such technologies to or such industries for help to co-process this waste. Because there's a lot of landfills in Egypt. We have a lot of them already, and like it's not the best to have in the first place. But what do you think of this strategy from an environmental perspective?
Well, I do think we have to differentiate there. There are different ways of treating waste for different waste streams. So if it's about hazardous waste, I mean, there are only three ways of treating it. First of all, it's incineration. That is mostly the one which should be used. It is hardly used in Egypt because we have a completely under capacity of treating hazardous waste over here, which is a big problem. So I would wish there would be more incineration plants to treat hazardous waste. Moreover, part of hazardous waste can be, but only part of it can be also used, and I think that's what you refer to, in cement plants. This is fine because, I mean, using it sort of replaces the fossil fuels. So some of them, Lafarge, Holcim, there are a few others, 4 from what I know, the big ones, partially use hazardous waste as a replacement for fossil fuels, but much too little. And this is not only sort of, you don't only need hazardous waste, you could sort of use most of the plastic which we have over here, which is produced or generated over here. You could this could all be sort of used in the cement plants by incineration to replace fossil fuels, but this doesn't happen enough because the coal is much cheaper and so on and so forth. So this is again a structural problem. So what I wanted to say, or coming back to your question, I think it really depends what waste you're talking of. The normal municipal waste, landfill is not not the solution anymore, at least not long term, because we know all the negative effects of landfills, even if they are controlled landfills, but still you have the leachate going into the groundwater if you don't really have a very good foil beneath, all this problem. So we should try slowly to get away from landfills, and if at all, then they should be controlled landfills. Most of the municipal waste you can go for MDP plants. This means mechanical technical treatment, and this is partially, do you still hear me? Yep. Yeah, I'm not gone. Okay, this is already partially being done over here in Egypt, and the new programs also focus on building more mechanical biological treatment plants where it's better if you send the waste there separately. I'm talking about municipal waste, but you can also use partially agricultural waste. This is the most ecological way of doing it. You can sort of also, if you do it in a more efficient or professional way, you can produce energy out of it, you can produce organic compost out of it, and you can even go for biogas. So I think this is actually the leading way. And incineration I would only recommend for hazardous waste, because incineration needs huge amounts of energy, of electrical energy. I mean, I know Egypt at the moment has a surplus, but still we should not actually use the energy for incineration except for hazardous waste, because if you use other methods like MBT, mechanical biological treatment, you get much more out of it. You go much more for recycling aspects, which I think is very useful and what we are aiming at. But for all of that, I think one of the biggest problems from my experience is actually the collection system, because up to now, actually not all the waste which is produced is collected, and that's why also sort of the burning of, or the production of RDF, etc. in salmon plants is so little, because they don't get enough of that waste. So we also have to improve regarding the collection system. But we also, an urgent issue is, well, tracking the whole waste, and in particular the hazardous waste, as it is so dangerous. And very often hazardous waste, if at all, is thrown on a normal dumping site, which makes treatment very, very, very difficult, and causes huge amounts of problems. Also, if you want to sort of later on, eliminate this landfill. I would leave it there.
I would like to ask a question. Is that possible? Or make a comment?
Yes, me too.
I do not see that we are trying to have any incentives to be able to reduce the amount of plastic that we use. We are the only country that so far distributes, when you go and buy anything from a supermarket, you go out with about 10 bags of plastic. Whereas if you were in any other country, US, you have to pay for a plastic bag so that you can reduce the amount of plastic that is being produced. And I think this is one way and one initiative that should go actually into a strategy for solid waste management in Egypt. We must stop using so much plastic and use any bags that are biodegradable. And a lot of people now are trying, but you can't do it alone. It has to be a pilot project whereby we take one community and we say, okay, all the supermarkets and all the stores are either going to use paper bags, or people can get their own bags or cartons to carry their goods, and stop using plastic bags. I think this will solve many of the problems that we are seeing, even when we come to sorting waste, because what I see, what the garbage collectors are doing, they are sorting all kinds of plastic, plastic bags, cartons of yogurt or milk or whatever, and they are recycling them. But if we can make it easier by also trying to address the issue of solid versus organic waste, just separation, garbage separation at the source. We haven't even done that till now. And whereas it is so easy, and it will alleviate so much the burden of waste collection, municipal waste collection, even if I do it at home. But then when the garbage or the waste collector comes, they just mix everything together. So all is lost. We are not, passing the message to and enforcing laws, and our laws vis-a-vis this area are extremely weak. We do not have that in place, and we need to think very seriously about reducing the amount of hazardous waste, which is not biodegradable. So if we introduce that and we take it into the programs that we are managing, for example, we at APE, we do not use any more plastic bags. We have paper bags. We give away our products that the women produce and that we sell in a paper bag. And the message is, we have our message on it: recycle, reuse, reduce. We must do something about that.
We hopefully do something about that, because it's becoming irritating, the amount of plastic that we use on a daily basis.
I don't know how come, with all the efforts that are being made to clean up the city of Cairo because of COVID, this has not entered into any agenda, and it should be led actually by the government. I mean, NGOs can try, but NGOs alone can create the awareness, can help in getting people to understand why we do not need any more plastic. But it should be a strategy of the government. I don't know if this is part of the environmental strategy that is being, I mean, of course, the strategy is big and very complex, but then this is one of the areas where we need to touch on. How to make
working on a multi-dimensional level is a must, of course, for things to get mobilized a little bit. Yes.
If I may jump in, yes, actually AP makes some beautiful bags. Really, they are really amazing. But I would suggest to go with bags like the one of AP and not to go with biodegradable bags, because unfortunately, how biodegradable are biodegradable bags? And I've seen a lot of unethical companies that are doing some biodegradable bags,
with you.
And they write eco-friendly plastic bags, but there is not such thing as eco-friendly.
I agree with you. I am not denying that there are many people who are going to take advantage of that, but let us start. I mean, let us start somewhere. If we start maybe in a community like Zamalek, where people are a bit more affluent or have better education, or even a smaller community of people who are very modest, there are many new developments that are now for housing for people who are, low-income families. It can start in a place like that, because the buildings are beautiful, but what kind of solid waste system do we have there? Is there any kind of initiative to make, are we doing exactly, I mean, have people moved from where they were to live in those beautiful buildings, and that nothing changes about how they manage solid waste, or how they clean up their premises, or how they look at something and appreciate what is beautiful around them?
Thank you very much, Ms. Syada. Of course, we can talk about the waste management issue for in another panel of discussion on its own, and we can talk about it forever. And the problem of plastic is, in fact, a problem that needs to be solved on a multidimensional level. But let me get back to the environmental aspects, and I have one more question in this section for Ayman. Regarding medical, since you have experience with a lot of hospital assessments at the moment and healthcare providers, what is the status of recycling? Medical waste is not really an easy job, and we're having a problem already to start recycling waste in general. Could you give us any insights about recycling systems for medical waste that are currently in place?
Yeah, I was actually going to ask Mrs. Ruth exactly about this point. Yes, of course. So, yeah, I mean, the issue of medical waste disposal and infectious waste disposal in healthcare settings in Egypt has been going on way before the corona issue. And the way medical waste collection is carried out in medical centers, in outpatient clinics, is very defective. And although they have to be subscribed and have to be paying for a subscription for collection of these medical waste, yet the percentage of actual facilities who end up using these services is extremely low, especially when we see that in many cases the collection doesn't even happen, or doesn't happen as frequently as it should be. When the situation with Corona, of course, it's more complex, because we are kind of forced to look at household waste as a potentially contagious one. And of course, the capacity and the infrastructure and the institutions that are in place are not going to be able to effectively address this issue. So I was actually going to ask Mrs. Ruth specifically about this point from her perspective, as she mentioned medical waste for this purpose exactly.
Yeah, well, the only thing I can tell you, we are just sort of looking at it. What I know is the public hospitals over here in Egypt, most of them, I mean, they're big hospitals, most of them have their own incineration plants or treatment plants, let's say. This is not always an incineration plant, it's normally only autoclave. So that means it doesn't heat up or burn the waste often sufficiently enough. We also think it is a problem which should be changed gradually, that sort of each hospital has its own, or most of them have their own treatment plants or burning incineration plants for the medical waste, because hospitals normally run them by themselves, but hospitals are not sort of, they're expert in medical issues, but they're not expert in running treatment plants or incineration plants. And there is a lack of control. This should gradually actually be more centralized. And for hazardous waste, and I mean hazardous waste is not only medical waste, hazardous waste could be chemical waste, could be e-waste, could be industrial hazardous waste, or different types of hazardous waste. This should be sort of more centralized and not sort of left to each hospital as such. So this is the hospital side of it. Now coming to Corona and the people who are now disposing at home, this is of course another problem where I cannot say that much at the moment, but I mean, as Ms. Syada Greiss said, anyhow, even if we separate at home, it's thrown together again. But then in the Sabaean community, the separation process starts once more, but under very precarious health conditions. So this whole system sort of gradually needs a change. And I also fully agree, because I think we cannot solve the problems now in the long term, that the informal sector should be gradually improved and formalized. There has to be a merger finally.
And maybe I have a question for you all actually on how to foster the cooperation between the private sector, governments, NGOs, multilateral institutions to tackle the surge in solid waste in such tight times. So maybe any one of you who would like to answer this question, but briefly, so that we can know how to move forward and how to foster such cooperations and allowing the space for them to exist.
If I may just come in, but now I'm more talking about the formal side of it. I mean, the treatment plants, or be it landfills, or in particular treatment plants, which exist nowadays, the government actually, at least that's what they say, want to privatize them. And I think this is, of course, also the right procedure to privatize these treatment plants and landfills. In Germany, they are all run privately or privately together with cities. And you can even make money out of it if you do it properly. But for that, you need framework conditions for the private sector to come in. And they don't really exist yet. I mean, you need security for a contract. They normally only get contracts of 1 year to run such a plant. In 1 year, you will not invest in this plant, and you will not do rehabilitation measures, and it's not long enough for some kind of public-private partnerships. I think, yes, the way is for public-private partnerships, but the conditions for the private sector to come in still have to be improved, have to be made more attractive, but on the other side also transparent with proper tenders and all of that. So I don't want to give a carte blanche to the private sector. They have to come in more. They have to be invited more to come in under more attractive conditions, but of course with a good control.
And I would like to totally agree with Ruth, and I would just like to add Because as in VeryNile, we really do a lot of these public-private partnerships, including media, celebrities, and so on. And a way to attract the private sector is also to work with the consumers. When you work with the people, when you work with the population, when you have thousands of volunteers for one cause, and you can bring some celebrity of engagement, stars, movie stars, and so on, it will definitely attract the private sector, because the private sector ultimately always wants to be on the side of the consumers. So I think it's also us as civil society to bring it as much as we can by doing some attractive things for the private sector, meaning working with the consumers, working with the cinema industry, working with the Ministry of Environment, in order for the private sector to see a commercial interest in investing into environmental initiatives.
May I add something?
Yes,
I think,
but very briefly, please.
Yeah, very briefly. I think when we're talking about all of the partnerships that you propose to have, I think it's a very complicated issue. We don't have the proper legislations to have the private sector come in under secure. The private sector is a for-profit and they want to make money. So unless you are going to enable the private sector to do that, and I've talked to several people who have started a compost plant. Okay, if you don't have access to all the material, the raw materials that you need, or the waste that will come so that your plant can function at full, you are going to lose money. So I think we have problems of coordination, problems of placement and locations, how we are going to divide the city of Cairo and put people, the different groups that are there. Who is responsible? Is it the governorate? Is it Ministry of Local Government? Is it the Ministry of Environment? And all of these, when they come to work together, do not have the executive powers lie at the hands of the governorate, but does it have the technical capability? I think it's a very, very complicated issue, and I have touched on it, and I find once we find a solution in this area where we can work together as partners for a common good, we will be able to solve the solid waste management issue of the country. But when we are all, disorganized and we're all competing with each other, because for what, I don't know, we won't have a solution. So I really hope that we can see a light at the end of the tunnel after all of these discussions and the different strategies that have been, many strategies were done by the Ministry of the Environment, or consultants have written strategies for the Ministry of Environment for solid waste management in Egypt. I cannot, the number is quite high, but we need action on the ground. That's what we need. Okay, thank you.
Thank you very much, Ms. Syada. And now the floor has been open to address some of the audience questions. And the first question is, the government has raised the price of dismissing medical waste from 4 Egyptian pounds to 20 Egyptian pounds. Doesn't that hinder the process? And this question, any one of you from the panelists can address if you'd like.
I can answer this briefly. It is of course a hindrance to the process, but I think the main hindrance is the fact that collection of medical waste in non-hospital medical facilities does not happen. It does not happen remotely sufficiently. And it's mostly a mandatory payment that these facilities have to pay without receiving a service in return. We have worked with so many medical facilities and clinics and medical centers, and I have yet to see, a decent medical waste collection process that is up and running in a way that is sustainable. I have worked in the best clinics you can think of in Maadi, where their medical waste hasn't been lifted from the facilities for 3 months, and this is something that is catastrophic. So of course the cost is an issue, but the main issue for me is the collection process and how effective it is, and this is even before the corona outbreak.
May I suggest? I don't believe that raising the price is really what hurts. I think people are used to paying nothing to get a service for nothing. And people need to feel that if they want a good service, to pay for it. And we don't have that culture in our country. We have always been so little and getting very little in return. And now there is a change which is being introduced by the current government. And people have to pay the price that is required. You can't keep subsidizing the services. People have to pay the real price of what it costs to burn so much electricity or to consume so much water. And I think this needs quite an education, but I don't believe that this is such a high price. People pay compared to what they pay for food. They pay that, or they pay for smoking cigarettes. Why do we find that exorbitantly expensive? I don't think so.
Ms. Ruth, you also had...
That's my opinion.
Yeah.
Yeah, well, I also wanted to actually argue into the same direction. If we want improved services, now talking about waste, we have to pay more. I mean, somebody has to pay the price, and I think people would be ready if they see that the services improve. They are also ready to pay more. But I mean, if they are asked to pay more and nothing changes, of course they would stop paying. But this has to go hand in hand. This has to be in parallel, and we have to, get the people used to the idea that they will have to pay more if they want a good service, because these are costs and the government cannot bear it all.
Thank you very much, Ms. Ruth. Any other additional remarks to this question? Maybe then I can move to the next question, and it's also addressed to all of the panelists. You're free to answer it. What is the most needed procedure missing for integration of informal collectors?
If I may jump in, I don't know what's exactly the most precise, but what I can tell is that unfortunately today, for me, the Zabalin are the real heroes of the city of Cairo, because we are the ones that is dirtying the city, we are the ones consuming, and the Zabalin are the real eco-entrepreneurs of the city. They are making a living out of the garbage that they are collecting. So the thing is that I really would like to see is much more gratefulness towards the incredible work that Zabalin has been doing for the city of Cairo. And as Mrs. Greiss was speaking about what happened with the pig massacres and so on, just to show, because the pigs actually are a component of the Zabalin in order to destroy all of the organic matter that the consumers may have. So the pigs are completely like a machine that are used in order to destroy some waste. And unfortunately, many people from the general population doesn't see the Zabalin as what the Zabalin are. You have a lot of misconceptions. Some people think the Zabalin are extremely rich. Some other people think that it's not clean to have pigs in Cairo. Some other people think a lot of things. So I think that in order to first reintegrate the Zabalin is to show the amazing impact the Zabalin have had on Cairo for the last decades. And if you take other cities in the world and you see how expensive it is to have a waste management system and how expensive it is for a city like Paris to pay all of the workers to go and collect the garbage, you can be sure that the Zabalin are taking on them a very big burden of this price that the city of Cairo should have been paid. And most importantly, they are really eco-entrepreneurs. So the eco-entrepreneurs in Egypt are not in the Greek campus. They are not where you would expect them to find them. They are not with the new app solution that is just there to go and collect some of the plastic that can be found in some companies. No, the real eco-entrepreneurs are the Zabalin. Of course, we need to formalize. Of course, we need to increase their capacity. Of course, we need to bring some more health regulation. And I think the previous minister, Dr. Laila Sana, did a lot of work to try to integrate them as much as possible. But I think that the first step, as me, as a social entrepreneur working on perception of the general public, is really to first change the global image that Zabalin may have and show a bit more of gratefulness for the work they are doing for the city of
I also think, of course, the integration is happening because they have already allowed them to form a syndicate so that they can get contracts from the government for collecting municipal waste. However, as well, this is not yet strong enough. They need a stronger support from the government. They need, as you said, recognition that they are citizens of this country. And I believe that now is the time for them to be able to really show, I mean, we are showing that in our association, and we tell them, we are the people who are Zabbalin, not you. You are the people who are cleaning the city, and we are the ones who are destroying and actually ruining what the city looks like. So you have to be proud of what you do. And once you make that statement, and I think it is coming because a lot of people are supporting them. However, there is still much more to be done. There needs to be much more improvement in their health, in their living conditions, because the living conditions are abhorrent. Many of them run businesses recycling plastics in the courtyards of their home, of their buildings, and that is brings on many health problems that are very dangerous. So we need to look at how we can help them establish better the technologies that have been developed to recycle plastic or recycle whatever they are doing in the community, and make that community at least a model eco village, which it can be, and it is located in a very important area of the city. So the integration is a must. It's not an if question. I think there is recognition now, but we all have to work very hard to give them the support that they need in terms of leadership, in terms of organization, so that they can get contracts and that they can do what they have been doing now for the past, since the 1940s. I can't even go back that long, and provide the location and the space for them to do this, because currently those who are in Manshiyat Nasser do not have the space to be able to do the recycling. They do it in their homes. They do the sorting of the garbage in their homes. What kind of an existence is this? So unless the government comes in and helps to upgrade the communities, and this is going to be, hopefully, the next step to a proper integration in the society.
Thank you very much, Ms. Syada. I think it's time to close up, and I'm very excited to have joined you today in this very stimulating discussion, and I really hope that based on our dialogue, we establish connections and we establish talking to each other to be able to mobilize some actions in the future, in the near future, or to put up some plans together to start tackling this issue and the accompanied issues as well. And I'd like to thank you all very much for your presence and for your insightful discussions today. And despite all the negative aspects that comes to waste, it's still a good thing that we're able to carry out such a discussion in such a place. Thank you all very much again. And I would like to also share with you that the next Cairo Climate Talks is going to be on food security, and it will take place on the 16th of September. And it would be great that you join us as well. Thank you all very much.
Thank you. Thank you very much.
Thank you.
Thank you. Thank you so much.
Bye. Bye. Thank you.
Thank you.
Bye.
Thank you.
Bye.